Sue, thank you for that introduction. This is going to be a fairly short presentation, so I'm going to start by talking about influenza in pregnancy and vaccination against it. We know that women of childbearing age are often exposed to influenza through contact with children, and that can lead to them having higher rates of influenza-associated disease in pregnancy versus non-pregnant women. And influenza infection in pregnancy increases the risk of maternal mortality, especially in late pregnancy when there's T-cell suppression and lung tidal volumes are being affected by the developing baby, particularly in the third trimester. Earlier in pregnancy, we know that influenza infection can increase the risk of miscarriage and low birth weight and premature birth. And we also know from experience of the swine flu pandemic in 2009-10 that actually women who've got other underlying health conditions such as obesity or diabetes are at additional risk of serious complications of influenza infection whilst they are pregnant. Children under the age of 6 months have the highest rates of GP consultations and hospitalizations for influenza in the UK. And unfortunately, we're not able to immunize that age group. There's no licensed vaccine under the age of 6 months. But we know that they can benefit from maternal antibodies if their mum has had the flu vaccine during pregnancy. Sorry, I'm just trying to, there we go. I thought my slides had stuck then, but they haven't. So influenza vaccination during pregnancy has this triple benefit. It protects the pregnant woman from the worst effects of influenza and from serious complications of influenza. It also protects the unborn child, and we know that it reduces the risk of prematurity and it reduces the risk of low birth weight compared to non-vaccinated mothers who've been infected with influenza during pregnancy. And it also protects the newborn baby, as it prevents the mother being a source of transmission of infection to the newborn child. And there's also passive immunity through transplacental transfer of antibodies to the infant, and that will protect it for the first few months of life. And that reduces the risk of influenza between 40 and 60%. It's difficult to be accurate about that because it depends on the kind of the strains of flu that are circulating in any one season. But certainly we know that there is transplacental antibody transfer. So when should we vaccinate pregnant women against influenza? Well, for those women who are already pregnant at the start of the influenza season, regardless of their gestation, they can be offered the vaccine as early as possible between September and November, really as soon as the flu vaccine becomes available. And certainly if they're already pregnant, we would want to get them vaccinated by early November before influenza starts to circulate in the community. It's not possible to be absolutely precise about when flu will start to circulate each winter. It does vary, but normally it's around sort of early to mid-November that we start to see influenza rates increasing. Newly pregnant women can be vaccinated throughout the flu season. And again, in terms of end date, it really depends on how much vaccine is left, or is there any vaccine left, and how much influenza is circulating late in the season. And we also recommend that pregnant women, if they are pregnant in subsequent flu seasons, get revaccinated. And that's because the flu vaccine, the protection from it is thought to only last for one season. And flu, rather like coronavirus, is subject to genetic mutations. And therefore, the strains of influenza protection contained in the vaccine change between different flu seasons. So that's why revaccination is recommended in subsequent flu seasons. For the forthcoming flu season, 2021-22, pregnant women should be offered one of the following inactivated influenza vaccines. They can have a cell-grown quadrivalent flu vaccine, otherwise known as QIVC, or they can have a recombinant quadrivalent influenza vaccine. And if neither of those are available, then the traditional egg-grown quadrivalent inactivated flu vaccine could also be considered. And then in terms of the safety of the vaccine in pregnancy, there was a review done by TAMA published in 2009 from America. They've been vaccinating women in pregnancy against influenza for some years, much longer than the UK have. And they found no study that demonstrated any increased risk of maternal complications or untoward fetal outcomes associated with inactivated influenza vaccines, and that inactivated effectively administered during any trimester of pregnancy. I keep on repeating the word inactivated because I think it's really, really important that people understand that we wouldn't normally recommend pregnant women have live vaccines, and there is a live flu vaccine. There's a nasal spray vaccine that's given to children between the ages of 2 and 17 years. The flu vaccine that's recommended for pregnant women is they're all inactivated. There's no live virus in there. There's no virus that's going to replicate, and it can't cause infection in either in the recipient or the baby. So that's why we give inactivated flu vaccines in pregnancy. In terms of uptake, it's actually quite difficult to measure vaccine uptake in pregnancy. You can see there that we normally get somewhere in the mid-40s percentage. But I think that there are difficulties around estimating uptake. One of those being that the way in which we count the numbers is that it's any pregnant woman who's coded as pregnant in their GP practice between, I think it's between September and the end of February. And that means that if they're pregnant at the very start of the flu season and quite late on in their gestation, they may actually have delivered before there's an opportunity to vaccinate them. So it's actually quite a difficult thing to count. And I know that colleagues in the flu team at PHE are looking at doing some additional studies in the forthcoming season to see if we can get some data from, or calculate the data slightly differently to see if we can get a more accurate figure. But that's where we're at in England over the last few years. In terms of pertussis, this is whooping cough. It hasn't gone away. It's still kicking round. This is a slide that shows the age-specific pertussis rates in England between 1998 and 2012. And you can see there, it actually doesn't matter which particular age group you look at, but what you can see there is that actually pertussis hasn't gone away. And every sort of 3 years or so, you tended to see a bit of a spike. And then in 2012, there was a considerable increase in cases of whooping cough. And whilst there were increases across all different age groups, I think the most significant ones there in particular, I think we've got increases in babies under the age of 3 months, so they won't have been fully vaccinated. And we've also got quite significant increases in 10 to 14-year-olds and 15 plus as well. So that was suggesting that actually it's possibly the adolescents and the adults that were almost like a pool of infection, and that's probably where the infants, where the babies under the age of 3 months were getting their pertussis infection from. So clearly something going on in 2012, and many other countries saw a similar pattern around the same time as well. We don't think the increase in infection rates with pertussis was related to vaccination, or certainly not vaccination uptake, because we had almost 95% uptake of all 3 doses of the primary course during that period. So it's probably, we think, is that the vaccine isn't providing long-term protection into adolescence or into adulthood. They're getting infected, and they're probably infecting very young babies. That's what we think is probably happening there. In terms of the overall effects of that, you can see that on the right-hand side of that slide there for 2012, there was an increase in the number of deaths caused by pertussis in 2012, and all of those babies were under the age of 3 months and therefore too young to have been fully vaccinated. So for that reason, in October 2012, JCBI, which is the Joint Committee on Vaccination and Immunisation, and this is an independent expert advisory body to the UK health departments, and they've been in the news quite a lot recently over COVID. They recommended that we introduce an emergency antenatal pertussis immunisation programme, and that became a permanent programme in 2019 because pertussis continued to circulate at increased and elevated levels in the UK population. In terms of the maternal programme, this slide I hope illustrates offer vaccines during pregnancy, because if you look at the cases, actually most of the cases were happening really sort of under the age of 12 weeks, and we don't give the first dose of pertussis-containing vaccines until 8 weeks, and they're not fully vaccinated until 16 weeks. So if you want to try and prevent infections and deaths in babies of that age, of just maybe a month or two old, then actually you're going to need to intervene earlier than that. And that's the rationale for offering the vaccine in pregnancy. Initially, it was offered to pregnant women from 28 weeks gestation, and it boosts maternal antibodies thereby providing passive immunity to the baby from birth until active immunity can be induced through the routine childhood immunization program. And I think that's probably a very, very important point, because what we're trying to do here is build this bridge of immunity from the time of birth out to a point where baby has had all 3 doses of the primary baby IMs, which protect against pertussis. It additionally prevents the mothers being a source of infection to their babies. And in 2016, some new research came out from Switzerland, which suggested actually you get higher antibody concentration levels if you give the vaccine a little bit earlier. So the recommendation was changed. It came down from 28 weeks down to 16 weeks. I know that often for operational reasons, it's offered after the 20-week scan, which is absolutely fine. We would normally recommend having it before 32 weeks. So ideally at some point between 16 and 32 weeks gestation. You can give it in later pregnancy. You can give it right up to the point of labor really, but the issue there is that the later you give the vaccine in pregnancy, the less the accumulative antibody levels will be in baby when baby is born. So better to give it sometime between 16 and 32 weeks gestation. In terms of safety and efficacy, there's been a number of studies looking at inactivated pertussis-containing vaccines being given in pregnancy, and it's not showing any association with stillbirth, preterm births, or other serious complications. And in terms of efficacy, providing that the vaccine is given prior to 32 weeks gestation, actually it's very, very effective. There's been a number of studies by colleagues in PHE showing that the maternal pertussis vaccination program is between 90 and 93% effective at preventing whooping cough in infants. So I think that's quite reassuring. We know the vaccines are safe during pregnancy, and we know that they are effective. I just wanted to end the pertussis section by talking about uptake. Apologies for the rather busy slide. You can see the bottom dotted lines are the some of the early data that we had around estimating pertussis vaccination in pregnancy. There were tweaks done to how that was calculated in 2016, which accounts for that rise there during that year. But generally what we see since then is a pattern of uptake of somewhere around 70%, sometimes a little bit lower, sometimes a little bit higher, but around 70% of pregnant women are being vaccinated against pertussis during their pregnancies. There does appear to be a little bit of seasonal variation, and it tends to dip a little bit during the summer months and go up in autumn and winter. And we think that may be because of the flu effect, that women are having their flu vaccines, and they're also then being asked if they would also like the pertussis vaccine at the same time. I think the other thing to note is the red line for 2020, and then the little blue line there on the left-hand side for 2021, because what we've seen there is a slight decline in the uptake of pertussis vaccine during pregnancy. Certainly in 2020, it looked like it was declining. That may be the effects of COVID. It may be that for whatever reason, women, whilst they are pregnant, are not getting the vaccine, whether that's reluctance on their part or whether that's been disruption to services that might provide it. But what we see, I think here, certainly between February and March, perhaps green shoots of recovery. It looks like it's beginning to come up a little bit, which is quite reassuring. And I just wanted to end by talking through some of the resources that we have around influenza and pertussis vaccination in pregnancy. There's an online resource called the Green Book, because when it's a paper copy, it always used to have a green cover, which is immunization against infectious disease, and it includes chapters on vaccinating against influenza and vaccinating against pertussis, including pregnant women. We've got a resource here. We've got some slide sets on maternal vaccination. They're very comprehensive. It also talks about other things like neonatal hepatitis B and rubella and things like that. Vaccine update. If you're an immunizer, then that's a very good resource to subscribe to, and it's free from us. All the leaflets and posters to help support the pertussis and influenza vaccination programs are available on the Health Publications website, and they are free to order. PHE develops these, we print them, we distribute them to the NHS, and they're absolutely free to order. If you register on that site for an account, as an individual, there is a cap on how many you can receive. I think it's only 5. But if your NHS trust and your trust has got an account with the Health Publications, then it's unlimited. You can order whatever you wish. Okay. We've also got additional resources on occupational vaccination of healthcare workers against pertussis, and guidance on how to manage viral rash in pregnancy. So I think I've gone ever so slightly over time, so I should probably stop there and ask if there are any questions.
Thank you, David. I think that's really helpful, because I think we've all been focusing a lot on the other vaccine, which I know that at the Ask the Expert session, which is coming at the next break, there'll be an opportunity for any of the audience to ask specific questions on that vaccine. But that's a really useful overview and update of the situation. So I know that there's one question come through. I mean, I did have a query, and I should probably know this, but do women get automatically sent leaflets on pertussis and flu vaccination, once they're registered as pregnant?
I don't think they get automatically sent leaflets about it. they should be called and recalled for vaccination, either by their GP or by their maternity provider. I should also say that the flu vaccine is also available to pregnant women via community pharmacies in England as well. The pertussis vaccine is GP and their maternity provider, if they are commissioned to provide that service. I don't think they would necessarily be automatically sent those leaflets about it. They are available to order, and maternity units and other providers are welcome to order those and send them, but I don't think there's any automated process.
All right, okay. So I was seeing that little beginning line for this year and thinking, well, what's that come from? And I was trying to think of, obviously, it hasn't been quite as easy to give as much information to women during the last year.
Yeah.
Anyway, now I do have a question from Laura Bailey. Hi, Laura. And she says, hi, David. As a community midwife, am I right to assume and continue to advise the vaccine at the women's booking appointment? When is the best time to follow up and remind women to have their vaccine?
Okay.
Good question, Laura.
It's a really good question. So I think the booking appointment is the ideal time, and I do appreciate there's an awful lot of information to impart and for the woman to absorb at the booking appointment. But I think the booking appointment is absolutely the right time to raise the issue or the offer of vaccination against flu and pertussis during pregnancy. I think if you're in the flu season, and if that booking appointment is occurring during that flu season, then you can direct the woman to whichever appropriate provider. It could be the GP. It might be that your maternity services are commissioned to provide it, or it could be a community pharmacy. And then anytime throughout the year, once the woman has reached 16 weeks, or she may wish to defer until after the fetal anomaly scan at 20 weeks, then again, it would be the GP that you could signpost to, or the maternity services if they are commissioned to provide the pertussis vaccine. But I think the booking appointment the ideal time to at least raise the offer of those two vaccines.
Fabulous. I mean, I know you appreciate that it's a huge appointment with loads of information going to women, but I think women will absorb some of it and if you give them the leaflets at that point, they've got that.
And I think, sorry, I'm going to go on a little bit further.
Go on.
Because in the interest of time, I didn't include this slide actually, and maybe I should have done. We did some research some years ago now. It's in the British Journal of Midwifery, and it's free to access. We've made it open access. I think my colleague Helen Campbell was the lead author. We looked at, we examined women's attitudes towards vaccination during pregnancy, and the women were overwhelmingly accepting vaccines, both for themselves and for the benefit of their babies. But what was really interesting, and what came across very, very strongly in that research, was how much they trusted the midwifery profession. They clearly trusted and want information about vaccination during pregnancy from their midwife. Other key professionals were up there, such as practice nurses, health visitors, and general practitioners. But midwives were absolutely the top of that pyramid, if you like, of healthcare workers in terms of who they wanted that information from. And I think that tells you a lot about the relationship that midwives have with pregnant women, and that close relationship and that information giving, I think is a key part of the success of this program, or both programs actually.
Which puts responsibility on midwives to keep up to date with the immunisation program, which makes this session really useful. I mean, I'm thinking the Green Book might have to become a favourite on your PC or on your
Yes.
app.
It certainly is on mine.
Well, it will be. It will be. Absolutely. But I'm just wondering also if it's on the Baby Buddy. I'm sure it will be on the Baby Buddy app that a lot of women will link into.
Sure. I don't know whether we link to the Green Book on Baby Buddy. I've done a lot of work with Alison Bohm and others at Baby Buddy, and they've been fantastic around vaccination in pregnancy. I don't think we would link to the Green Book because that's a resource for healthcare professionals. I think we'd probably link to the NHS website and other kind of public-facing websites for Baby Buddy. But it's a great resource, and we continue to work closely with them.
I think I connected the two, but it's not. No, I would appreciate the Green Book would be a bit indigestible for women, whereas the Baby Buddy they could put little reminders in there, which I'm sure are there.
They are.
So that's fantastic. Okay, and I've got another query from Chilone Lee Wo. I hope I pronounced that correctly. Chilone. Lovely name. Pharmacists and GP nurses tend not to comply with adding the vaccines given to maternity documentation. How can this be rectified?
Oh, gosh.
I've had women not knowing what vaccine they've been given. So we need to email the GP for information, whereas the midwifery service report to GPs and HSE when a vaccine is given.
Do you know, that is a really interesting question. So the way in which we calculate uptake data for both pertussis and flu vaccines in pregnancy is we automatically extract it from GP practices in England. So we tend to get really obsessed about the flow of data. So if the vaccine's been given in a pharmacy or by midwifery services, we get really obsessive about data flow's got to go to the GP. And actually, it flowing the other way is really, really interesting. So I'm now going to show my relative ignorance about maternity records and whether or not they are still handheld paper records, which the pregnant woman would have, in which case the pharmacist or the general practice nurse should enter it there. But if it's an electronic record, I guess we would have to make sure that the practice has some way, some access or some kind of electronic data sharing from GP record to maternity record. And hand on heart, I honestly don't know whether or not that exists.
Okay, well, that's,
but it's something for me to take away and have a think about now.
That's obviously your afternoon homework. I mean, I'm just wondering also, how does this connect with the new NHS app, which you can access? I don't know if audience within the UK have tried this out, but you can you download your NHS app and you can get into your GP's records. It's fantastic. And that's got all your vaccines or whatever. And I'm assuming, dangerous, but it might just connect with other vaccinations, as long as, I guess, with the GP. So that's the fundamental flow.
Yes, or if not given by the GP, that's been communicated to the GP, and the GP's then been able to code it in such a way that it appears there appropriately. Sue, I think that means I've got a bit more homework to do, actually.
I'm afraid you might have. But I wonder if with the vaccine, as is now, some of these systems are going to be smoother. I wonder.
I really hope so. I mean, I think we'd all like to see greater interoperability between different IT systems and get it all joined up. I think that would be really, really useful, and maybe the app that you've described is going to help us do that. Fabulous.
I think this is I can sneak in one more question from Heather Franklin. We've started using Badgernet, which is online. There's no reason why the woman cannot be given her vaccine info on a slip like a prescription that can be added by the next healthcare professional she sees.
Okay. Right. Thank you. I must confess I've not heard of Badgernet, but again, I'll add it to my list of homework. I've got a notepad by my side here.
Well, we like to give our speakers, as well as great thanks and applause. You only can have my applause for now, but I know there'll be lots of people who will be applauding you now. But we also like to leave our presenters with a little homework. So that's David's afternoon taken care of.
It's been a two-way process. I think that's really useful. Thank you.
And David, are you at the Meet the Expert session as well?
At 12:30, talking
Fabulous.
about COVID vaccination in pregnancy and
Fabulous.
breastfeeding. Yeah.
Okay, so there's a little advert for those of you watching.
Yes.
Stay online at lunchtime. Before you have your lunch, go and check out with Ask the Experts. So thank you so much, David, for updating us so brilliantly. Fantastic.
Okay, super. Thank you.
Okay, we're now moving swiftly, as we do, on to A2, seminar A2, and we're welcoming Dr. Bethan Collins, who is Head of Occupational Therapy, School of Health and Society at the University of Salford. And Bethan is going to be talking about the experiences of blind and partially sighted women, what midwives should know, what we need to know. So welcome, Bethan. The screen is now yours. You have to put your sound on, that's it.